Johnston and I'm the Oakey Clinic Manager. This is just a message from our Oakey team just to let all our community members know that we're here to keep you healthy, safe and strong. As you'd be aware, we have the girls at the front desk that will come and talk to you and ask you questions before you come into the clinic.
Hello Mrs Slater, how are you today? Social distancing is what we're practicing here at Goondir Medical Centre. So have you travelled overseas in the past 14 days?
No.
Have you been in contact with anyone from the past 14 days who has been overseas? So that's really good. What symptoms are you presenting today with?
Sore throat.
You got a sore throat? Okay. Well, what we'll do in this case is we'll take Mrs Slater around the back to the triage centre. Would you like to come with me, Mrs Slater, around the back? Won't be a moment. Excuse me, Karen. Someone will have to man the front so that we've got someone at the front at all times. Coming right around the back, and I'll take Mrs Slater around here. To deter people coming in because we want the area to be as safe as possible. Now what we do is here, we take our temps, blood pressure, our sugars, all of our normal screening tools. We take the report into our RN, Tanya. Will then come out, have a look at the patient and decide whether to send to the doctor or straight to the triage centre in Toowoomba. Thank you.
Other measures that Oakey Goondir is putting in place is making sure that everybody is using hand sanitizer, making sure that we're doing the social distancing at 1.5 metres between everybody, and making sure that we're still continuing to deliver our holistic health care, but doing that now through telehealth. This is where you can ring here and we will make sure that the doctors are aware and we'll get them to ring you back and we can do a consult that way.
Hello, my name's Louisa. I'm one of the GPs at Goondir Health Services. We're trying our hardest to reduce the risk of community spread of infectious respiratory illnesses, especially the coronavirus that everyone's worried about, but also influenza A, other respiratory illnesses. That's about all our clients so far. It's been sort of lower risk, but if they've got respiratory illnesses, we're seeing them at the back near the van, just at the back of the building in the open air, that we can keep problems with viruses. Infection control is easier to manage outside before it comes into the clinic, and giving them advice then and helping them if they need to have any scripts or medications, because people still got their heart disease and their diabetes to worry about as well. People who are pretty well with no suspicion for infectious diseases, we're still seeing people through the clinic if they're low risk, healthy young people, but people with chronic diseases like diabetes, heart disease, chronic airway disease, we're saying they can ring into the clinic if they're well, but they just need some of their medications or they need some advice on how to best look after themselves and want to know what's going on, and they can ask us for phone consultations, either with the doctors, health workers, RNs, and so we're just trying to do our best to keep the community healthy and not to panic. You can just do your best and lower your odds of getting sick. Thanks very much.
Goondir Oakey has also got a plan and action. As per normal, Goondir provides its patients with the flu vaccine, and this will continue. It will just be done in a different way, but rest assured that we'll be there to give them out to our community members. The big message that we want to be able to give to our patients and our community and our family is to stay safe, stay healthy and stay home.